So I'm going to be very basic with this. 90% of dry eye is caused by the lack of hygiene. What I really emphasize, again, I go into the slit lamp, I look at my patient's eyes, I see what's going on. Even sometimes when I don't see it clinically, I start simply with cleaning around the eye. I recommend two things. I recommend the AccuSoft scrub, and I also recommend the Optase scrub. Either one, not both together, but either one of these. This does not have tea tree oil in it. Some people are sensitive to tea tree. I recommend the AccuSoft. I really like the Optase. Optase, it's a product from the UK. It has tea tree oil in it. Also is preservative free. I'm leaning towards a lot of preservative free products these days. So I'm really, this is my number one go-to for cleaning around the eye. Women also can use it as an eye makeup remover. It works well as long as you don't use a waterproof mascara. So it kind of kills two birds with one stone. When patients come in and say, my eyes feel dry, and it doesn't matter what symptom it is, I start with lid hygiene. And I send them home for a month, cleaning their eyes, and then also doing a warm compress, which is 10 minutes at a time daily, 2 to 3, 4 times a day, depending again on the severity of the dry eye. But I recommend the mask. So I recommend these two things for 1 month by themselves. Go home, try it. Let's see how your eyes feel. Okay. 90% of dry eye is caused by these meibomian glands not producing the proper oil and being clogged from the everyday dirt, dust, allergens, things like that. So those are my first step, first month of treatment. That's what I recommend. Patients come in, they have, bags filled of artificial tears, things like that. A lot of times, once patients start cleaning around their eye and using the warm mask, their artificial tear use goes down quite a bit. However, if they do need an artificial tear, again, I go more towards the preservative-free products. This is an over-the-counter found in the office, in the stores. This, I have Optase, again, a UK product. I carry it in my office. Preservative-free. I like it because it's in a bottle versus the individual vials. Everybody's different, to each his own, but preservative-free is really the best way to go. This is the simple at-home treatment that I would strongly recommend. Again, cures most of my dry eye patients. We could do something called Retain. And then there's a biologic that I've also been recommending, which is called Regenerize. It's expensive. It's from doctors' offices. It actually helps with the inflammation of the eye. It's an embryonic tissue from live births that provide all of the substances that help with inflammation in the eye. Okay. Inflammation is pretty much the number one cause of dry eye. What causes the inflammation are those glands not being clean. Okay. And that's where I always go back to lid hygiene, lid hygiene, lid hygiene. And it's not just contact lens wearers, because our eyelashes, they actually capture all the dirt, the allergens, everything that's in the air. That's why we have eyelashes, because they protect our eyes. So if we don't clean those properly, that dirt is just going into those glands that are around those eyes. So that, I promise you, would probably be the number one treatment. And you're going to feel the best relief just doing the proper hygiene.